Hi, this is Mo from Wound Academy. We are trying to make a series of short videos, so it's going to help you with the wound assessment, wound management, and it's going to help you to learn wound care in a simple way. So if you are new to this field, if you are physician, nurses, or other healthcare professionals that like the wound care, you are in a good place, and we will help you to learn step-by-step wound care in simple way. So this short videos is going to help you a lot. Let's just do it. I know you're tired of COVID-19 at this after a few months, but I'm trying to make it very short. So what are the steps in the wound care? So the first step is assessment. So when we talk about assessment, I'm not talking about just the local wound care assessment. We have to assess the other factors, like especially the factors contributing in delaying wound healing process. So what factors causing delaying wound healing process in general? So we have to assess the patient underlying disease like diabetes, like autoimmune disorder, anemia, malignancy, all of those things causing impaired wound healing. The next one is impaired perfusion and hypoxia, like arterial ulcer. So the patient who is smoking, the patient who has like some heart disease, those are causing impaired perfusion. Malnutrition, if anyone that cannot have enough protein, carbohydrates, lipids, and trace elements and vitamin essential for all phases of wound healing, that's going to cause a problem. Like we have to look at the body mass index. Like if the patient is very thin, that's important, because that can cause pressure injuries and bony prominences. Or if the patient is overweight or obese, we have to look into moistures, that's sweating, that's causing skin issues. The next one is if the patient has a sensation problem, if the patient has diabetes, if the patient has cerebral palsy, they don't feel it, it's getting very worse and then worse and worse, then we will find out, oh my, the wound is so bad. That's another thing we have to look into it. Medication, NSAIDs, chemotherapy, corticosteroids, immunosuppressive drugs, those are all causing the wound healing delay. Radiation therapy is the next factor that we have to consider. Stress, anxiety, and depression. Local factor inhibiting wound healing. So wound management practices. The goal is to optimize the wound healing so healing progresses. Moisture balance. So we have to have moisture balance for a good healing process. So we have to use the right dressing. The next one is wound temperature and pH. The studies shows that temperature 37, it's the best temperature for wound healing process. pH, we have to look into pH like a neutral or acidic pH, because those one doesn't let bacteria grow in the wound like the bed. Another thing we have to consider it is infection. Infection is a big factor in this one. So we have to recognize infection. However, there is local infection and systemic infection. That's gonna be another video. We will talk about it. Pressure, friction, and shear. And if we have to look, sometimes we don't realize that there is foreign bodies in the wound bed. And sometimes if when it comes to the time, I will explain some cases that I had really, and we found small objects in the wound bed that causing infection and doesn't let the wound to close. In the next video, I will talk about the type of wound, like acute versus chronic.